All right, I'm going to talk about the Aetna cancer policy, and specifically that would be the one I go to when packaging a cancer benefit. Usually, a lot of agents are going to sell the Plan F. As we know, the Plan G is the more popular plan right now, just because it's better for the client. I think if you can take the Plan F, go to your Medicare handbook, and really explain that for the client, what the Plan F entails and what the average premium is. Turning 65, I'm explaining how that average premium is going to be in the 140 to 150 range. And then I'm going to go to that Plan G now and try to package the Plan G, which on average with what I'm packaging is around $96 a month in that range, with the cancer benefit anywhere from $20,000 to $10,000 to $20,000 in that range, and try to explain to the clients how I'm going to give them this extra benefit, which is going to keep them below that Plan F premium and provide them with an additional cancer benefit. It's really important, in my opinion, to explain why we are recommending that cancer benefit. And if you can do this all up front, package it together in terms of the Med Supp and the cancer benefit, instead of going, hey, here's the Med Supp, filling out that application, now let's talk about a cancer. It has to be as one package to really get those all together, I think, is where I found success. Some key points when packaging those is you want to talk about what Medicare does not cover in terms of cancer. And if you're using the Aetna cancer benefit, I think it's really important you bring out this brochure here. It explains some really important statistics, in my opinion, with cancer. 1 in 2 men will be diagnosed with cancer, and 1 in 3 women will be diagnosed with cancer. 77% of all those cancers are going to be in those 55 and older, which obviously is the market we're dealing with. Now, what Medicare does not cover in terms of cancer. Deductibles, co-payments, obviously if you're dealing with a Medicare supplement, obviously not a huge issue there, but a Medicare Advantage plan, this could be really something to hit on there. Experimental treatments, so Medicare doesn't approve it, obviously your supplement and Medicare will not pay for it. The big one here, in my opinion, would be experimental drugs, and just drugs in particular with cancer. That's where they're going to have the least amount of coverage. I've had a client that pays $2,500 a month for a prescription that Medicare does not cover, so that's a big one. Family care, lodging, travel expenses, those are all big areas to hit on. And the last thing I really like to go to is on Medicare.gov. It says here at the bottom that your doctor or healthcare provider may recommend you get services more often than Medicare will cover. So if you can pull that right off of Medicare, I think it really adds value to your presentation and will help you package a lot more cancer benefits. Overall, if you're just, there doesn't necessarily have to be a history of cancer in the family. If you can just stick to the point that, hey, I'm going to give you this Plan G, add a cancer benefit, and essentially give you more benefits than that Plan F would have for less money. A lot of times it can be a no-brainer for the client, and they really feel like you're doing them a service by giving them something that a lot of people aren't even asking for.